Hi, I'm Dr. Stephen Bircher from Optima Health and Vitality in Eau Claire, Wisconsin. Today I'd like to share with you a definition of health, how you can measure your health, and how you can achieve the level of health that you desire and maintain it. First, I'd like to give a little background on myself. I grew up on a farm in Iowa and studied animal nutrition and learned how to raise healthy animals and in a healthy environment and good food, studying nutrition in 4-H and FFA. After high school, I got drafted in the Army and spent 10 years in the Army as a maintenance test pilot for helicopters, learning how to diagnose and repair and fix complex systems. And after I got out of the Army, I went to Iowa State University and studied more biology and nutrition, and eventually went to Palmer Chiropractic College and graduated in 1981. From there I moved to Chippewa Falls in 1981, and I was there until 98, moved to Eau Claire, and I've been here ever since. And in my practice I've focused on functional health. And the definition of functional health is just looking at health as a level of function. And I put at one end of the scale, 100% function is all of your organs working to their capacity all the time, which I define as perfect health. And at the other end of the scale is 0% function, which is dead. And we are functioning at different levels every day. Our function varies a little bit each day depending on what we do and how we rest and exercise and how we eat and live and think, breathe. And what I have seen over the years is that there are people who are functioning at about 50% function. They're still living life. They're still performing and getting something done, but they're not living to their potential. And the traditional healthcare system that's in place today is the medical model, which is a good model for the lower end of the functional scale. When you get down to about 30% function, you start having organ failure, pathology, diseases, and in that realm of function, medical care is the best at diagnosing the problem and intervening to save that organ or save your life and turning that around so that you don't die. But beyond the disease model, most people are in the functional realm. And so the disease model doesn't really work very well in the functional realm. And I focus my attention on the 30% to 100% function to measure your level of function and design a system of care and coaching that you do at home to improve your level of function to as high as you desire and help you to maintain that for the rest of your life. Those are systems that I've put together, that I've studied to be able to measure how healthy you are. And functional testing has to do with how does your body function in that capacity that you want it to function in. And I've studied functional neurology, functional chemistry, digestive disorders, functional hormonal testing to find out what those levels are. I also studied functional fitness testing so we can actually measure how strong you are, how long you can work with that strength. And in the study of that, one of the textbooks that I really like is a book called Biomarkers. And Biomarkers is the measurement of health indicators. And this book was written by a PhD by the name of Evans and a medical doctor by the name of Rosenberg. They did a research project at the USDA Human Nutrition Research Center at Tufts University. And they were using older people who were considered in their declining years and their level of health probably isn't going to change very much. And they took people from in the 60s up into the 80s and put them in a 16-week program of healthy diet, exercise, rest, nutrition, and measure their level of function, and they all could improve their level of function at that late age. And the level of function that they used as indicators were lean body mass, or how much muscle mass you have in your body, the strength of those muscles, the aerobic capacity of those muscles, how long could they do that work, basal metabolic rate, which has to do with metabolizing fuel and turning it into energy, body fat percentage, blood pressure, insulin sensitivity, which is relating to the end product of poor insulin sensitivity is diabetes, which is the fastest growing healthcare problem in the U.S. Cholesterol and HDL ratios, which has to do with heart disease, bone density, and body temperature regulation. Those are the indicators that they used in the research project. Those indicators came from lots of other research projects that proved that these indicators are things that you can measure now that predict how healthy you are into the future, and they proved to be very reliable. So that's kind of the background of the tests that systems that I learned to use.